Hello everyone, welcome to our new module. This is your chapter 16, Newborn Perinatal Guidelines. That is your P00 to your P96. In our previous chapter, we discussed about the mother's record. So we're talking about the mother there in chapter 15. Now, it's time to move on for the newborn codes. Okay, so your chapter 16 will tell you about the newborn perinatal guidelines like P00 to your P96. So let's start with the first guideline in your chapter 16. Okay, so since we're talking about perinatal, let's define what is your perinatal period first. So your perinatal is before birth through the 28th day following birth, meaning up to the delivery, up to your 28 days after the delivery. Okay? That is considered newborn because after the 28 days, it's no longer considered newborn. It's already considered infant. Okay, so since we are talking only about newborn here, so we are only talking about the a newborn up to 28 days. That is the definition of your perinatal period. Okay, so your guideline number one there, the use of your chapter 16 codes. Your chapter 16 codes is never used on the maternal record as we discussed because your maternal record is all being coded in your chapter 15. And your chapter 16 codes may be used throughout the life of the patient if the condition is still present. Because remember, there are conditions like it is being diagnosed right after the delivery, and that condition may present up to the whole, throughout the life of the patient if the condition is not being treated. Like, for example, your cleft lip, your cleft palate, like that. If it's not being treated or it's not being repaired through a surgery, those codes may be considered throughout the life of the patient. Okay, now I know we discussed in the chapter 15 about the code which is your Z37 if it's the baby is being delivered in the hospital. Now, in the newborn, the counterpart of your Z37 is your Z38. Okay, this is the code for the newborn and used only once at the time of birth. It's the same guideline with your Z37 wherein you can only use that once, and your Z38 is being used in the newborn record. And please put a note that your Z38 should always be a principal diagnosis. Okay? And you can use Z38 if the baby is being delivered in the hospital. Okay? That is your Z38. You can only use Z38 if the baby is being delivered in the hospital, and it should always be your first listed code for the newborn. Okay? Next guideline is your birth process versus your um community acquired conditions. I already skip your number 3 and number 4. Okay, you have your use of codes from other chapters with codes from chapter 16 and your use of chapter 16 codes for after the perinatal period. So let's go to your number 5, birth process or community acquired conditions. Now there are conditions like it is already present right after the delivery. We also have conditions that is community acquired, meaning the condition is being acquired right after the delivery. I mean, it's being acquired outside already. Now, it's not present right after the birth, but it is being acquired, okay, during the delivery or after the delivery. So if it's not stated in documentation, the default is always due to the birth process. Like for example, the common example here is your newborn sepsis, that a newborn sepsis may be present right after the delivery, but the patient may also a newborn may also suffer um, um newborn sepsis because it's community acquired. Okay, so if it is due to the birth process, use your chapter 16. But if the condition is community acquired, you can no longer use your chapter 16. It's being coded, like for example, if it's sepsis, it is coded to your chapter 1 for if it's community acquired sepsis. Okay? All clinically significant conditions should be coded if it requires clinical evaluation, therapeutic treatment, diagnostic procedures, extended length of hospital stay, increased nursing care or monitoring, and has implications for future health care needs. So you need all capture the diagnosis about the patient if it requires all of the following. Here in your guideline, all significant conditions should be recorded if it requires all of the following. Okay. Next one is your observation, letter B, observation and evaluation of newborn for suspected conditions not found. Meaning, like, for example, the after delivery or before delivery, the provider suspected for a condition that it may be present to the baby, but it is justified that that condition or that suspected condition is not present right after the delivery when checking the newborn. Okay, so use for that one, if it's the suspected condition is not present to after checking the newborn, you will going to use your code Z05. Okay? You use your Z05 if a suspected condition is ruled out, meaning ruled out, it is already found out that after evaluation of a healthy newborn, okay, after evaluation of a healthy newborn and that suspected case is not really present and the newborn is really healthy. Okay, do not use Z05 when the patient has identified signs and symptoms already of a suspected problem. So if there's a signs and symptoms of the suspected problem, you can code the signs and symptoms already and you no longer use your Z05 because you can only use Z05 if the suspected condition is not present. Okay, now your Z05 should always be a first listed, but sometimes if it's coded with Z38, Z38 can be your primary. Your Z05 can be a primary or can be a secondary code. Okay, it should always be a primary if Z38 is not applicable. But if Z38 is applicable, Z38 should always be your first listed as I mentioned in the earlier slides. Okay. Z05 on other than birth record. You may also be assigned as a principal or first listed code for readmissions or encounter when the code from category Z38 code no longer applies. So Z05 can be a first listed diagnosis if Z38 can no longer be applied. Okay? Z05 on birth record, use a secondary code after the code from category Z38. Live-born infants according to place of birth and type of delivery. Okay, so you can code Z38 if Z38 is allowed. I mean, if the conditions or the scenario allows you to use Z38, Z05 should only be a secondary code because remember, Z38 should always be your first listed code. Okay? Next example. Okay? Prematurity and fetal growth retardations. Okay, so we're talking about your prematurity and fetal growth retardation here. In this guideline, there are difference between prematurity and fetal growth retardation. So providers utilize different criteria in determining if it's a prematurity. A code for prematurity should not be assigned unless it is documented. So remember, your prematurity should always be documented if it's present. You cannot code prematurity if it's not documented by the provider. Now, there are two different things. Like, there's a different code from prematurity and there's a separate code for fetal growth retardation. Okay? Because as you can see, P05, disorders of newborns related to slow fetal growth. Put a note there in your chapter 16 about P05. We are talking about your slow fetal growth. Okay, your P05 can be a full-term baby, but it is malnourished. Okay, there's a slow fetal growth because the baby or the fetus is malnourished. So P05 can be a full term. But there's a fetal growth retardation because the fetus is malnourished. P05. While in your P07 is disorders of newborn related to short gestation and low birth weight. Meaning, There is a low birth weight because it is because of the short gestation, or it is premature. So for prematurity, your code is P07. For slow fetal growth, fetal growth retardation, or slow fetal growth or fetal growth retardation, you need to use your P05. Okay, so only one code for P05. But for P07, you need to have two codes for P07. Now, since we're talking about P05, we're talking about slow fetal growth due to malnutrition, while P07 is the baby is small, or there's a low birth weight because of short gestation, meaning they can never be coded together because they are two different things. But they have same thing in common, that the baby is small, or it's low birth weight. I mean, there's low birth weight, or the baby is smaller than the usual or than the normal one. But for P05, it's due to malnutrition. P07 is due to prematurity or short gestation. Okay. Now, when you are coding P07, both birth weight and gestational age are, if the birth weight and the gestational age are available, you need to have two codes for category P07. And you always need to code the weight first before the gestational age. Now, in your sequencing in your tabular list, your code, I think point zero should come first, your weight, before the gestational age. So follow that. Um, when you are coding P07, you need to code first the P07 for the weight, and followed by the gestational age. Okay? You always need to have two codes for P07. And weight comes first before your gestational age. The fourth character will tell you the 0 first before the 1, or 1 first before the 2 in your fourth character. So I mean, you have a key, or you have a reminder, the sequencing of codes. Okay, so when you are coding P07, keep in mind that you should always have two codes, and you should code first the weight, followed by the gestational age if available. Okay? So, low birth weight and immaturity status, your P07 disorders of newborns related to short gestation and low birth weight, child or adult who was premature or had a low birth weight as a newborn, and this is affecting the patient's current health status. Okay, so here's the example before okay. Newborn twin girls delivered in the hospital via cesarean section at 27 weeks, weighing 850 grams for twin A and 900 grams for twin B. Okay, so both were diagnosed with extreme immaturity. What ICD-10-CM code should be reported for both twins? We're talking about both twins. Okay, now the question is, in this scenario, as per your, so the problem here is the baby or the newborn is only 27 weeks, meaning it's short with the gestation, because normally it should be 28, 29, 30, 31 weeks. Okay, this is the normal weeks. But okay, since it's only 27 weeks, meaning there's a short gestation, correct? So for this one, you will going to use your P07. And remember, there's a weeks of gestation being stated here, which is your 27 weeks. And you also have your weight. Now, as per your guideline a while ago with P07, you need to code for the weight first, followed by the gestation, correct? So in here, you need to have two codes for P07. So let's eliminate your letter A. You can eliminate letter A because there's only one P07 here. Okay? Letter B, okay, that could be fine. P07.0 and P07.26. Letter C is also fine. We have two P07. And your letter D, we also have P07. Okay. Now, when you check the code of P07.03 and P07.26, because they are the same here, now, remember the weight should come first. And the code for the weight is P07.0 first before 0.2. That's what I'm talking about a while ago, the fourth character. 0 comes first before the 0.2. So in this one, it should be 0.03 first, correct? So if 0.03 should come first, you will going to eliminate letter D as well. because this is the gestation and this is the weight. Now, as per our guideline a while ago, you need to code first for the weight. Okay? So correct. So your letter B and C is your remaining options. Like the 2P07 is correct. P07.03 and P07.26. Now the only difference is your Z38.31. And remember your Z38, remember our guideline for Z38, they should always be a first listed code. So your option B is your correct answer. Okay? Your letter B is your correct answer. But I just want to highlight about the use of your P07. Now, I have a question here. Like, sir, there are two weights there. We are talking about the twins, correct? We have 850 grams for twin A and we have 900 grams for twin B. So why don't we have a two codes for the weight? Because we're talking about the twins. Okay, when you check P07.3, there's a bracket there. Okay, there's a bracket of weight, and 850 to 900 grams belong in just one bracket, and that is your P07.03. That's why it's no longer necessary to code a separate for the other twins. And of course, they have the same gestation because they are twins. Okay, so that should be letter B. Okay. Next one is bacterial sepsis of a newborn. So please keep in mind, please highlight the code there. Your P36. That is your code for bacterial sepsis of a newborn. Again, every time you hear the word sepsis, okay, of a newborn, you always need to code for the organism if it's present. Okay. Now, if there's no organism yet, P36 only is your code. If there's no additional causal organism yet being identified. But if there's already a bacteria, I mean, an organism being determined or being confirmed, you need to code also for the organism. And again, if there's a severe sepsis, remember, you need to add your R65.2. And since there's also a severe sepsis, should always be followed by an organ dysfunction or your organ failure. Okay? And the last one, I think, for your chapter 16 is your stillbirth. And your code for stillbirth is your P95. No other code used with this and not to be used in the mother's record, meaning the baby is already dead right after the delivery. Okay, or it can be during inside the womb. It's already dead. Okay, so that is your stillbirth, and your code for that is your P95. Okay, that ends our chapter 16. In our next module, I'll be discussing chapter 17, congenital malformation, deformations, and chromosomal abnormalities. That is your category Q00 to Q99.